Hi, everybody. I'm Dr. Alyssa Watson.
And I'm Dr. Katie Berlin.
Thank you for joining us in the Veterinary Breakroom. In the break room, we have short conversations where we just get to chat informally about things that are going on in veterinary medicine today. And this week, we actually decided to sit down and talk about some things we had seen in clinic lately. Dr. Katie, along with a few of our other colleagues, have kind of this group chat going, and I feel like lately it has been full of cases that have all been pretty interesting, and we thought maybe you guys at home might want to hear a little bit about some of the kind of bizarre things we've seen lately.
I will say that mine are less bizarre than they are just like some of the things that remind you that it's, you know, we fixate on the negative stuff and like these are just wins. You know, we always share a win of the week, but like these are all wins, or they're just things that made me happy or things that made me glad to be in the clinic. And may I just also say that our group text of veterinarians is my lifeline many times. And coming back to the clinic after a hiatus has been a lot better because I've been able to like phone a friend with you guys and be like, is this what I should do? Or like, would you guys do anything else here? Because, oh my gosh, I don't know what I would have done a couple of times, especially in urgent care. So thank you for that.
Yes. Absolutely. Thank you to all of you. I hope you guys at home have somebody, especially if you're in a practice where you're by yourself, or you're doing urgent care, an overnight shift or something like that. Having that just kind of group of people that you know you can shoot a text off to and send an x-ray to or a clinical picture and say, have you seen this before? Or, you know, what? And I know that there's online groups, you know, that serve that function as well. But it's also nice to have somebody that you just know and love and is a really trusted colleague. So I feel very fortunate to have several of those in my life. I also feel very fortunate that over the years, I have cultivated a pretty good relationship with our local specialists. And I'm going to take this opportunity to give a shout out to Dr. Chris Smith, who is our local ophthalmologist here in Las Vegas. He is incredible, and he probably wishes at this point that he had never given me his personal cell phone number. Because I'm in clinic about twice a month, you know, pretty regularly every other week. And for some reason, every single clinic shift that I have worked in the last month, I have had some weird ophthalmology case that I'm like, are you kidding me? And eyes are not my favorite thing. They're not something that I totally loved. I didn't love my teacher in vet school, and I think that had a lot to do with it. And so it wasn't something that I'm super, super comfortable with. But I had literally in the last, 2 months, I have had a case of SARDS. And then right after that, I had a case of optic neuritis. So I had these two like acutely blind cases. And it was really good refresher to sit back and try to remember like, okay, here's all the reasons why an animal might go acutely blind. And then I also had a melting ulcer case. And then I had a case that came in that I think I probably jumped the gun on a little bit. It was a young intact male Akita, and he came in for vaccines and had really bad blepharitis and swelling all around his eyelids and some crusting and hair loss. And the owner thought that was potentially from, he had been giving him goat's milk. And so he was like, oh, I started giving him goat's milk, and then this started around his eyes. And so then he stopped the goat's milk, but then the eyes were getting worse. And so I had in the back of my mind remembered that there was this weird thing with Akitas and, depigmentation and crusting and this UV dermatologic syndrome. And so I was like, oh my gosh, I know what this might be. And I got really excited, and I text our local ophthalmologist, and I took some pictures, and he came back and he said that I was not wrong, that it could be that, but he said that it was probably wasn't, because that he said generally has a much more striking clinical presentation than what this dog was showing. But we ended up treating for immune-mediated blepharitis, which was with prednisone anyway. So I ended up backing into the right treatment anyway, and I felt like that was a win.
The right treatment is steroids or not steroids.
Right.
In this case, it was steroids.
Exactly. So then I think after those cases, I was like, okay, I really need to do something. So I sent the whole clinic a care package.
That's so great. I love that you did that.
Well, you know what? It takes 2 seconds to order it off of Amazon, and like I sent over some healthy snacks and stuff like that, and it made me feel better. And I know that they never would have accepted it if I didn't just do it. So.
Oh, I love that. Yeah. A specialist who will take your call, whether it's their cell phone or at the office, like, and they'll actually talk to you. It's the best. I've learned so much from them. Like, shout out to Sarah Dowling for being on the phone with me one night at 9 p.m. about this dog with this crazy nose fungus. That was a whole crazy case. But anyway, that was a long time ago, so I'm not here to talk about that. But yeah, aspergillosis is always a possibility, is the moral of that story, even in a 7-month-old puppy in Pennsylvania.
Wow.
Anyway, yeah, that was crazy. I actually had a weird case. I had a steroids, not steroids case recently that had to do with the eye, actually. And I chose the wrong option. And so this case is not really a win, although the dog did get treatment. But I've been doing relief pretty regularly, like a couple Fridays a month at this one clinic. And so I'm starting to be able to do a little bit of follow-up where I can actually go and look up cases and see how they did, or I get to see them for my own rechecks, which is nice because when I was doing relief like here and there and doing urgent care, I didn't get any of that and I kind of missed it. I don't miss the like 2 hours of calls and records every day of catch up and like clients that only want to talk to you. I don't miss that right now, but I definitely miss knowing what happened after I treated a pet. And this was a dog who was being seen for otitis and was really painful. And it seemed like he was getting more painful instead of less with the treatment. And the owners seemed like they were pretty compliant, but they were like, he just, it seems like he's really painful and he didn't really want to eat. And I have seen dogs that don't really want to eat because their ear's so painful. So I was like, maybe we're treating with the wrong thing, maybe we need some steroids. And the technician and I took the dog to the treatment area to clean his ear out and stuff, which was not something we were able to do a very good job of because he was very painful, but it didn't really seem like his ear was painful. It just seemed like he didn't want us around there. And so I was a little afraid he was going to bite us. And then at one point, we offered him a treat and he went after it and then he screamed. And we were like, oh, it's his mouth. Like he doesn't want to open his mouth. And we tried gingerly because we were afraid he was going to bite us. And he screamed again when we tried to open his mouth. And I was instantly, I've had a few of those masticatory muscle myositis cases, just a few of them through my career. And they were always just like really dramatic. And in most of the cases, I'd seen them when their head was already sunken in, and all atrophied. But I knew that initially, in the early stages of that disease, they're just really painful. And those muscles actually are not shrunken yet. And so they might be able to open their mouth a little bit more and be able to eat, but it's painful to do that. So I was instantly like, oh my God, does he have MMM, And I was looking it up and I was trying to figure out, what I could do in the short term. And I knew they didn't have the money to spend on a test, especially that test, the 2M antibody test can take a long time to come back, I think. And so I basically needed to get him through till they could see the vet that they usually see, and also to see if his ears were going to get better with the treatment I was using, because I still wasn't 100% sure that his ear wasn't part of the problem. It was a very inflamed ear. So I had this like mental battle where I didn't want to put him on immune suppressive doses of steroids, but I also knew that he needed those if it was MMM. And so I ended up like putting him on a lot of steroids, but not like that many steroids. It was just a high dose of steroids in the hopes that whatever was inflamed I could take down. And this was a Friday, and like they would be able to see whether he was getting better or not getting better, and come back in for a recheck early the next week. And it turned out that he ended up going to a specialty clinic, an ER, I believe, that had specialists there. And it turned out to be a retrobulbar abscess, was the diagnosis, which they only found out, after CT and all those things. And obviously I didn't have access to any of that, but I also did not retropulse his eye. And I have never seen a confirmed retrobulbar abscess in my career. Not one. And I have probably retropulsed a bazillion eyes. But this is one of those things that, me being out of the clinic for a while and being out of my normal routine of doing things, combined with the dog who is already being treated for something else. So I probably had a little bit of a blinder on for that. And then also I was a little afraid he was going to bite me, so I wasn't like pushing on his face a lot, so I did my exam from as far away as I could. I missed it. I don't know if I would have felt that it was there, but I think I probably would have noticed that his eye didn't retropulse normally. It looked normal, but the retropulsion wasn't there, and so I missed it. And I put a dog with a retrobulbar abscess on high doses of steroids. So he's doing well, as far as I know now. On follow-up, he was doing well, but technically I screwed that up, and it's because I sort of got off on one track where I thought it might be this one weird thing, and it ended up being another weird thing. And thankfully he's doing well, and nobody's mad at anyone. But that was one of those cases where I was like, oh, I probably wouldn't have missed that, 5 years ago. And who knows? But I probably would have been a little bit more in my system at that point, right, and had more differentials in mind. So it was a good learning case. And I also learned a lot about MMM because I had to look up all that stuff again too.
Yeah, you had to go learn it all again. I definitely, several of those cases that we were, that I was talking about too. Same thing, SARDs and optic neuritis. I was going down the algorithm, like,
yep,
which arm do we go down here? Gosh, you're telling the story, and then I'm thinking again about another steroids, not steroids case that I just had. I had another one, and I ended up picking the wrong thing here too. Unfortunately, I had a young German Shepherd with weight loss and chronic diarrhea, and he, same as you, he was painful. He was skittish. I should have sedated him and done a better exam and rectal exam. And I didn't. I was like, well, we'll run some blood work and stuff first. Because that he was okay for. He let me draw blood on him where he was just standing, and the techs were offering a treat, and I kind of crawled down just like a car, and I drew blood from his dorsal pedal vein, just with a butterfly catheter, and it was awesome.
Cool.
I felt really cool.
Yeah, that's impressive. You kind of want to jump up and be like,
yes, yeah.
I have made fire. That kind of moment.
Right. But I was like, oh, this is going to be, EPI, right? This is a young, intact male German Shepherd with chronic diarrhea and weight loss. This is going to be exocrine pancreatic insufficiency. And definitely I did find out several weeks later that it was not. And his little pancreas was fine, but he did have really horrible ulcerative perianal fistulas. Yeah.
Well, those are a bummer.
Yeah, it was.
EPI would be better.
Yeah, EPI would have been better. It was bad, and it was the perianal fistulas, and we probably should have gotten him on immunosuppressive medications sooner than they did. So another learning curve. Should be doing that rectal exam with everyone, and sometimes that means taking a minute out and going ahead and sedating, or getting them back in the next day and saying, we really need to do sedation with this. So
yeah, it's important to share these too, because we all miss things, and sometimes things are, they're not obvious to us when we see the pet, and they're obvious to the next person, but sometimes we do just miss stuff. And most of the time, we probably don't even know that we miss it. And as a relief vet, somebody who's not seeing the same patients all the time, it's very easy to think you're getting it all right or all wrong. And the person I work for right now is really cool, and she's not going to like call me up just because I missed something. She's going to call me if I made somebody really mad or if I did something dangerous. But, she realizes we're all human. So she also uses a service. I wanted to give a shout out to this service because I've had a run of check lump while I've been there over the last few Fridays. It's always my favorite. It could be a nipple, it could be a tick, or it could be, a giant mast cell tumor, which one of them was. So check lump is always just really fun and nonspecific. But this was a really great owner. And the aspirate, is the kind you could see from space when you put the slide under the microscope, and it's like on 10x and you can see the mast cells.
So it was I was gonna say, is it mast cell?
Yeah, so it was a good example to show the team, because not everybody on the team was comfortable with cytology. So it was cool because it was really beautiful, and I forgot how beautiful mast cell tumors are, but it was also enormous. So thankfully she's going to a surgeon and going to get that sorted out. But I saw another lump that day that I could not identify. I'm not a cytology queen. I like a good mast cell tumor because I know what it is, even though they can be nasty. But this one I just couldn't. So the clinic that I work at uses a service called Pocket Pathologist, which is run by Kate Baker. She's the creator of Vet Hive. She's a clinical pathologist, board-certified pathologist, and she's amazing. And Pocket Pathologist has its own app, and you can actually submit cases one at a time, and you don't have to, it's not like you need like a clinic account and like management has to like, manage this monthly invoice or whatever. You pay $52 a case, and you can send in photos. She like has a tutorial for taking microscope photos with your iPhone of what you're seeing, and guidelines for like what types of photos to send in and what magnifications and stuff. And then you write a history of the case, tell her where it is and all the stuff. And then she or one of the people on her team will review the case and then send you back a report. And in this case, I sucked at taking microscope photos. So she actually messaged through the app and was like, let's talk about how to make these better. Hello.
Can you share those tips? Because I try all the time. I've tried taking the little roll of tape. I put the little roll of tape on, and like my iPhone has 3 different lenses. Which one do I line up? It drives me nuts. If I could figure out a good way to take microscope photos with my iPhone, it would be a game changer.
She has a YouTube video that's pretty good. So maybe we can link to that in the show notes.
We're doing that afterwards.
Yeah. But she may have tips too, just on the Pocket Pathologist website, because she's like, it's not just you. Like, no one is good at this right away. It is really hard. And the clinic even has like a holder for your iPhone, like a little holder that, you take the eyepiece out of the microscope and like put your iPhone right up against it and it holds it still. And I still sucked at it. But I was able to get at least enough images that she could use. And so that was a really good learning experience. But it was also really cool to be able to do that and just send it out. And it's $52. So you can pass that cost on to the client or roll it up into your cytology fee or whatever. But I loved that she was reading it. I'm sure there are AI services that also do that. I'm also sure that I would be scared to completely trust AI with something that I can't identify myself. Right now, there might be very reliable services out there, but I have not used them enough to know. So knowing that a board certified pathologist is looking at these and telling me honestly what she can tell and not tell from them was really good peace of mind. And then I could just submit all that and then go home for the weekend, and then my boss could get the results on Monday or Tuesday or whatever and follow up with the client and know what needed to be done. And I just wanted to shout that out here, because as somebody who does do all of my clinic shifts alone right now, I really miss having colleagues to be like, do you think that's, or do you see that thing, or would you agree? Because I used to do that all the time. So
could you listen to this murmur? That's my other.
Yeah, exactly. Like,
Yep.
you hear that, right? So anyway, shout out to Kate Baker and Pocket Pathologist for the win.
Well, let's see.
And then
any other cases that you had?
Well, I just wanted to say that I'm really excited that because I'm not practice hopping so much right now, I get to see puppy appointments again, and I get to see the same puppy come back, you know, sometimes. Like, because people with a new puppy usually want to see the vet they know, but people are starting to get a little bit more used to me. And so I've gotten to see a few new puppy appointments, and I really miss those. Like, when you see a puppy on urgent care, it's not usually like a fun thing. So so seeing the new lab puppy come in and he's just like a chunk, you know, and he just like chunks right down in your lap. I miss that so much. So I'm very grateful for that part of practice coming back into my life a little bit too.
Yep. Those little chonkers are the best. I'm the same with kittens, especially if they'll fit in my pocket. That's one of my favorite things. You can get a kitten, it fits in your pocket. I don't know, you have to put a kitten in your pocket. That's one of the perks to this job, is to be able to carry around a kitten in your pocket.
Totally agree. Yeah. This is a hard job. You got to take the joy.
Right. Well, I feel like this whole episode was kind of wins, clinical wins, or at least wins and lessons. Mm-hmm. I don't know. Do you have any non-clinical win? I actually have a little non-clinical win that I was going to share with everybody when we wrap up today.
You know, there's one thing that I wanted to say just because I've been following it on Instagram. And it's like sad, but it's also the internet coming together in like the most beautiful way. Have you been following that story about the anglerfish? You know? I
saw that.
Yeah, so this anglerfish, you know, it's the ones that are like in the deep and they have a little lantern hanging from their head. Yeah, and they're like you know, seriously. Nemo. Yeah, and they're so weird looking. You know, they have these like giant underbite of teeth, you know, and this little light bulb that dangles off their own forehead, and that, you know, they're just like a little ball with teeth and a light. And they normally live in the complete darkness except for this little light that they produce themselves. And this anglerfish like managed to get into the shallow water, and it died in the shallow water. I mean, I'm sure it's not meant to live there, but everybody's calling it the angler. I don't know if it was, you know, or anglerfish. Anyway, there might be something that, you know, if there's an anglerfish adult, it's a female or something. I don't know. I can't remember if there's some weird fact, but all these beautiful things now are hitting my feed just because I read a news story about how this, you know, somebody found this anglerfish in the shallow water and it was so unusual. But there's all of this content now that people are making, like videos and movies and artwork and poems about this little anglerfish that found herself in the light right at the end, you know, like just for a second she got to see light that she didn't make herself, and then she died. And it just is like, oh, I can't even handle it. And no. I'm going to tell you the real reason that this gets to me so much is that when I was in school, when I was on clinics, there was an ancient Pekingese. I can't remember her name, but she was like 100 years old, and she was, you know, a patient when I was on internal medicine or something, and she had to be euthanized. It was in oncology, I remember, because Dr. Erin Malone was with me. And we took her outside to the yard to euthanize her. And her family wasn't there. They didn't want to be there. They had said their goodbyes. And so it was like the intern and me and this little dog who we all were kind of joking about her that week that she looked like one of those anglerfish because she had this really big underbite and she was all gnarly, you know. And we put her to sleep out on the lawn. And I feel like that was a very moving moment for me because it was such a formative time. And I'll never forget that little dog. And this anglerfish just makes me think about that little dog. Anyway.
Oh my gosh.
So it was not really a win. That was sad. But also it's kind of beautiful too, you know.
It's really beautiful, and now you've completely changed my story, like, and what I was gonna talk about.
You're gonna talk about like a really good sandwich you had or something?
No, I wasn't. No, I wasn't any. But you're telling that story. So I had a kind of a similar experience with, you know, when I went to Iowa State and I actually tracked equine. And we had a horse that was, you know, when I was on one of my rotations in the barns, and she had pneumonia and she had a chest tube in, and we had kind of like just hit her financial limit. The owners were like, this is where we're going, and once we hit that limit, we're done. And they had hit that limit, and so we needed to put her down. We needed to euthanize her humanely with dignity. But we took her, you know, we were going to walk her over, not do it in the barns, but, you know, walk her over so that she would be closer to, you know, where they needed to be for her aftercare, for her body aftercare. And when we did that, we took her out, and she actually kind of got a little spunk and reared up and pulled the lead out of the student's hand, and she ran off down the road. Oh, no. And she got one more just like beautiful run. And it was a beautiful day, and like she just looked so beautiful out there. And then she really was struggling. Like after that, she couldn't breathe well, and it was time. But that story you just told made me remember that. I'll never ever forget her just rearing up, pulling out, running down the road, and we had to all chase her down the road. And then she finally couldn't run anymore. She got tired, and we brought her back and fed her lots of sugar cubes and carrots and let her lay down peacefully. So
this job can be so beautifully sad.
Right?
Yeah.
Exactly. Oh. Okay. Wow. That wasn't where I expected everything to go.
I know, right? That anglerfish really got to me.
All right, everybody. We are so glad that you guys joined us on the break room. We love having you here. I hope you enjoy our stories and what we have to bring about what's going on in practice. And yeah, if you have ideas or if you have things you want us to talk about, let us know. Drop something in the comments, you know, send us an email. We're here to talk about the things that are important to you all in clinical practice. Thanks for joining us in the Veterinary Break Room. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@vetmedics.com. Veterinary Breakroom is a VetMedics production produced by Alexis Ussery and co-hosted by me, Dr. Alyssa Watson, and Dr. Beth Mollison.